On today's World Insight, Impartial international efforts to get to the bottom of the pandemic source. What will it take to get a professional fact-finding mission on track in the spirit of cooperation?
At least a year or more until the pandemic is over before we truly have answers on this.
And the science behind an inquiry into COVID's origins, details from a group of well-respected medical experts and scientists.
Here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei. As the COVID-19 pandemic still takes a heavy toll, the world sought answers to its origins. It's good sense to leave tricky jobs to the professionals. China looked to the World Health Organization to treat the coronavirus origin tracing work as a scientific probe, guard against the political interference, and seek answers across regions worldwide. China was the first country to carry out joint research on COVID origins with WHO. Earlier this year, for example, a 34-member WHO China joint expert team carried out a 28-day research mission in Wuhan. On March the 30th, the WHO issued a joint report which came to clear conclusions and provided science-based recommendations for the next phase of the study into global origins. So how could scientists cooperate on the serious scientific inquiry? And what can keep away polarization on political lines, which only create more hurdles in finding clear answers? Let's loop in our panelists from different parts of the world. For investigations on the origin of COVID-19 in Washington, D.C., Kate Tulenko, CEO of Corvus Health in Seattle, Dr. Alice Kim-Kang-tan, internist at the Ms. Medi Women's Hospital from South Korea. In Shantou, China, Dr. Hua Chen-Zhu, associate professor from the State Key Laboratory of Emerging Infectious Disease from University of Hong Kong. Great to see all of you ladies, and I'm glad this is a discussion among ladies. It means that women are really in the front line of both research and the medical world. Congratulations to all of you on that. Having said that, though, you know, the trace of the origin of COVID-19 is such a complicated issue. Many wonder what are the timelines that we should really look at in terms of when we could have any results. Dr. Tulenko.
Yes, I think as far as the timeline, it probably will be at least a year or more until the pandemic is over before we truly have answers on this. Because with the pandemic still raging, it's a problem of access to people and not wanting to expose people and put them at risk. But I do think that the WHO has the proper expertise on their panel, but the WHO has expressed concern about not having access to the people and the places that they've wanted to really properly investigate the origin of the pandemic.
Dr. Zhu, as far as I know, there are quite a number of people, for example, in China, that has been advocating not only to do investigations and research of the trace of origin in China, because the virus has no boundary, but also go to other places when there were earlier cases apparently look alike COVID-19 were reported in Europe, Italy, for example, in the United States as well. So how do you see this, the scale of investigation and research?
Absolutely. We need to have the investigation, not just in China, but also outside of China, because this virus is actually quite broadly spread and distributed in the world. So we have to know more about this virus. And actually, there are more and more evidence pointing to the possibility that this virus may first occur in regions other than China, or probably it could be that like there are multiple outbreaks here and there, and Wuhan is just one of the epicenter at the very beginning.
Interesting. Dr. Chen, of course, you and I have been talking about the pandemic from, at that time was still an epidemic from earlier stages. And we see how scientists have been trying to work together. Things are getting more complicated when politics involved. But looking at the COVID virus and the earlier, 100 years ago, the flu, for example, how long the investigators and the scientists took to figure out exactly what happened. How are we going to be smarter this time in trying to design a roadmap and also to design a way of thinking for the research and so-called investigation?
Well, I think it was July 16th when the WHO talked about the introduction of a scientific advice looking into the origins of novel pathogens, including the SARS-CoV-2 virus. And they put forward 5 different areas of research that need to go on. And I think it's simultaneously. They are going to be doing research into what they call a One Health approach to looking at disease. And it's an integrative perspective looking at humans, animals, and the environment and the interface and the intersection of all 3. They're also going to study looking geography. Do we need to look elsewhere? Geographically, they want to target the areas where the outbreak first occurred, but also I think the Rhinophilus bat is a bat that seems to carry a virus that's very similar to the SARS-CoV-2 virus. And so they're looking at geographical regions where a host animal, a natural reservoir might be living. And then they're also going to be looking at studies into the animal markets, I think, near Wuhan, and animal traceback studies. Lastly, they do want to do audits of relevant laboratories as well. And I think the reason why is because even though this was the least likely scenario, they just want to leave no leaf unturned in terms of possibilities of origin. And that's kind of the roadmap that the WHO has put forward. And I think it's going to be a very complicated task, multifaceted in nature, and in terms of timeline of when we will be able to find the cause or the culprit pathogen. For SARS, I think we were just lucky in finding the civet cat, which was the host animal for that virus. But with SARS-CoV-2, more difficult. We may need to look harder and broader.
After even the pandemic broke out, we see different countries have very different approaches. So one might also ask, when the first outbreak was identified in China, whether there could be negligence elsewhere in the world about the possible small-scale community transmission and things like that. In that regard, one could also ask, so what should be, the investigation or research about COVID-19 in the world today regarding its origin?
Early identification of an outbreak. And so that's a rise in the number of people dying. And so to identify that there is an outbreak actually doesn't take a lot of scientific muscle power.
No.
It really is just counting the deaths and looking at excess deaths. So I don't think that there was a significant outbreak elsewhere that was unrecognized. Whether or not the virus originated in China, I do think the first major outbreak was in China. But I wanted to say a thing about sort of the politics of this. There's been a lot of finger pointing, blaming different countries or different institutions. Basically, understanding that the most important thing is for us to find out what happened so we can prevent it from happening, and also sort of get closure, and not say, well, someone has to pay, or someone's going to be punished. And I think that is really the most healthy attitude, and the attitude that will help the world work together better now and in future pandemics as well.
Dr. Kim Kyung-tan, I want to have the same question to you as well. I know it's difficult for scientists to take positions now, and it's unfair, in fact, for them to take positions according to politics. But even from a science perspective, how collective this research should be in terms of the origin of the virus. The scale and the speed is one thing, but the origin is another thing. These are two very different issues. We see two arguments. One is to concentrate on one country where the first known outbreak took place. The other argument is about whether we should further investigate some of the biggest possibilities of origin and scale up a bit so that we could have different information coming in rather than just focusing on one country, one outbreak. So this is a very different approach, but I want to have your opinion.
Well, this entire investigation needs to be collaborative. It needs to be international, unbiased, data-driven, and transparent. And that's really the only way forward. When there is a big problem, a crisis, the most important thing is to troubleshoot and figure out what happened. The most important thing is not to blame people. And most of the time in management, it's also quite well known that a blameless environment is one that is going to engender transparency, and it's going to encourage people to be open-minded and to speak up when there are problems. And I think that's the way that we need to approach searching for the origins of SARS-CoV-2. In terms of where to look, and the where and the when of how the pandemic started, I think the initial investigation that happened in January, February of 2021, the WHO and China joint investigation team, they started investigation into this, looking to see, in terms of when this might have started. Did it start prior to December 2019? And they've been able to limit that time frame of when this may have all started to at the latest maybe, or at the soonest, mid-November 2019, and most likely December. So that's the time localization. In terms of geographical localization, as I said, they are considering places where bats that carry viruses that are similar to the SARS-CoV-2. They're looking at those locations in Southeast Asia, in East Asia, in China, but also they mentioned the possibility of the frozen food, the cold chain, and possibly animal products or infected products being delivered into China, into Wuhan, and that starting the infection. And so I think looking broadly is the right approach. I don't think we have enough information to really zone in on one area right now. And this whole investigation is so important to carry out for three reasons. First of all, the pandemic's not over. It's been 18, 19 months and it's still not over. And discovering the origins and possible animal reservoirs will help to elucidate what is going on and perhaps prevent further spillover, zoonotic, what we call animal to human transmission. Secondly, trying to figure out what happened will be so informative to prevent the next epidemic and pandemic of an emerging pathogen. And then thirdly, that will give some sense of closure, I think, to all of the millions of people around the world who have suffered, endured this, the millions of people who have lost loved ones, including 7,000 healthcare workers who perished in the front lines working through the pandemic.
This is a very difficult investigation and very difficult research. As we said, from day one, politics already coming in and makes the international organization in a very difficult position, and also makes geopolitics playing a role. Dr. Zhu, we see the exchanges of words between China and the United States, for example, regarding the laboratories. The US was advocating go and research about the Wuhan laboratory, even though there were discussions already taking place with the Chinese scientists by WHO and others. Dr. Fauci even also earlier, a few months ago, mentioned about that, the slightly slim, very slim possibility of coming from any laboratory. Also, China has been asking why the international community hasn't investigated the United States. Some of its laboratories also have the capabilities of spreading and also coming up with virus that's similar to COVID-19. Well, that's my interpretation, not necessarily the words by word coming from the Chinese government. So I didn't have a direct quote, but the meaning is something similar. So Dr. Zhu, how much should these laboratories around the world, I mean, the one that has the level of a Wuhan laboratory and above be investigated? How much do you see the capabilities of human-produced virus in terms of its possibility to COVID-19? Dr. Zhu.
Okay. So I think that the problem is that when science is absent from the unknown or those not well understood phenomenon, it gives some space for the conspiracy theory. And theoretically, any laboratory which possess the infectious material, they can be criticized or be suspected for this kind of possibility, not just the Wuhan Institute of Virology. Any laboratory that has animal samples, either from bats or the other kind of animals, they may have the possibility of handling, manipulating the samples. And I have a concern that for those laboratories that do not have a biosafety level 3 or 4 facilities, there might be even higher risk theoretically. Yeah, so I think that if there's no evidence, but we are just suspecting each other, that will create a very toxic atmosphere. And this kind of stigmatization is actually not friendly for anyone. And it will make the scientists quite hesitating in whether I should do this kind of work. For example, for me, now I have the feeling that, previously, we have been working on the source tracing of MERS, of many influenza viruses, and even SARS. So we have a lot of samples here. What if one day people criticize or suspect that there might be something happening and related to us? Then how should we explain that? So I think that first we need to stop this kind of passing the buck or criticizing each other without any evidence. And more importantly, I think that scientists should take the responsibility to do more works. For example, if we can figure out what would be the immediate precursor virus related to the SARS coronavirus 2, then you will give a more reliable or solid evidence that the nature origin might be much more possible. So let's take SARS or the MERS as an example. So actually our team did a lot of work there. So previously, there's also lots of suspicions and also conspiracy theory. But after we collect thousands of, tens of thousands of samples from the wild animals, then we also conduct the sequencing. And actually, I should say that the genome of a virus can talk, can speak for themselves. If you conduct the evolutionary analysis, it gives you the exact date how this virus or when this virus emerged and how it can be transmitted between the different individuals or animals. So I think absolutely we need more solid evidence from the scientific community. And also the better surveillance we do, the more evidence we can provide. And that will make the space for conspiracy theory like limited. Yes.
Dr. Tulenko, your final thoughts before we wrap up.
Well, I think that, one of the questions we were asked to look at was, what sort of research will come out of this? And I think there are 4 streams. One is the basic bench research on the virus and understanding how it replicates and how quickly it creates variants, but also there'll be a separate line of research on, medical interventions, antivirals and interventions to calm that inflammatory storm. And then there'll be one on vaccines. And, this is a really exciting time because the COVID pandemic was the first time that both mRNA vaccines and the adenovirus vaccines were used commercially. So I think we will see a golden era of vaccines and more vaccines against infectious diseases and possibly against cancer. And then the 4th stream of research I think we can see coming out of this is the non-medical interventions. That that's the mask wearing, the social distancing, and how we can better protect people and getting the evidence for that. Because one of the main barriers to being able to institute mask wearing was the lack of evidence that mask wearing is effective.
Kate Tulenko, Alice Tan, Hua Chenzhu, thank you so much, ladies, for joining us and helping us understand your insights and expertise. Thank you, really appreciate it. And you're watching World Insight. Coming up, the science behind an inquiry into COVID's origins. Details from a group of well-respected medical experts and scientists from around the world. Next. As of today, the COVID virus origin tracing is important, complicated, and a sensitive issue, and must be handled in a professional, impartial, and constructive manner. It should be conducted based on science, drawing on worldwide studies and research by scientists and medical experts. On this, I've been talking to a group of well-respected medical experts and scientists from around the world over the past year. Let's take a listen of what they had to say. We have been hearing a lot about whether China and the United States should cooperate. What's your take?
I think that we do need to cooperate. We, for example, have been working with Professor Ludahai in Sun Yat-sen University. I'm going to begin working very shortly with Zhongnan Chen, also in Guangzhou, in our new respiratory disease hospital. We are also working with people in Brazil and Mexico and Indonesia, all over the world, trying to find ways to make the world a safer and healthier place. We want to make sure that nothing like SARS-CoV-2, like COVID-19, ever happens again. The best way to do this is to establish a global network where anytime there is a cluster of people who become ill, there's a team that becomes aware of this. They send whatever resources are needed to identify the infectious agent, to figure out how it spreads, and to contain it so it cannot become a threat to a city like Wuhan, or Beijing, or New York, or Rome, or any other place in the world. the concern right now that people have about where this virus came from needs to shift away from blame. It's Chinese or Malaysia or US, whatever, it doesn't matter. Viruses don't recognize borders. They are everywhere. Any virus can cause threat to human health is a threat to everyone. It needs to be considered an international problem. We need to make sure that the very best minds in the world focus on these problems. And we need to start thinking in human terms, not Chinese terms or US terms or French terms.
There's a trend of anti-science rhetorics going on, but how do you as a scientist face up to those things?
Your point about misinformation that is spread by social media is a very important one. As you know, with editing and artificial intelligence, you can completely change what someone has said and make it sound as though they're saying something which is completely opposite to whatever it is they mean. And those people who are responsible for these platforms, TikTok, WeChat, Facebook, Twitter, all of these different social media platforms need to find a way to monitor what's being distributed so that they can be certain that it's accurate. This is not going to be easy, but this sort of misinformation spreads like a virus. I see something, I post it, somebody else posts it, 10 other people post it, and before you know it, people think that to get a vaccine means to put a robot that's circulating through your body collecting information. This is crazy, you know. People have accused Bill Gates creating vaccines that have, things that record information on them. It's not possible, it's not true, but it actually dissuades people from taking vaccines. So one of the things that I am focusing a lot of my work on right now is not really perceived by my friends who are scientists as being valuable, but it is. I work with Hollywood, I work with social media. We are putting out various public service announcements that explain to people what they need to do to protect themselves and to protect their communities.
After this round of pandemic, will still people be thinking hard about what to do for prevention and control?
One of the problems with public health is that if you are successful, nobody knows you're there. So there have been outbreaks that we have stopped in certain parts of the world, in Asia as well as in Africa, which you've never even heard about. Why? Because we stopped them when there were only 6 people infected. We are able to isolate them, give them drugs to prevent further replication of the virus, and so you've never heard of these viruses. We've seen this before in New York with West Nile virus. The first indication that we had a new virus in North America was the death of large numbers of birds. That was a mosquito-borne virus. Nobody paid any attention to it because it was just birds, but it then spread from birds to animals in the zoo, to people, and before we knew it, we had a new outbreak of encephalitis. So surveillance needs to be focused on the animal kingdom as well as on humans, and anything that occurs in an outbreak must be investigated, must be reported to the World Health Organization, must be declared important. Because what happens is, it happens in a city, the mayor, the other people affiliated with the city try to contain the information because they don't want to interrupt their business or their tourism. But ultimately, you can't control these infectious diseases. So you might as well be upfront and open about it from the beginning, because then you can minimize the damage. Anything that starts anywhere in the world is only a nonstop flight of 14 hours from any place else. So it doesn't make sense to call it the China virus, the Italian virus, the US virus. It is a virus, and we need to deal with it.
When you were in China, do you find much evidence at all there were underreporting? Because the numbers are extremely important in terms of what measures to take in order to fight against the virus.
Sure. In the world I work in, there's two things are important, but the most important usually is the trend. Are cases going down? Are cases going up?
Right.
What does that angle of increase or decrease look like? Because that's really what tells you what's happening to this virus. And the first thing I would say in China is that the decreasing trend is absolutely real, no question. Are you finding every case? No. We never find every case in a situation like this. But what you're looking for, again, the second thing you're looking for is not necessarily every single case. That has to be your goal, every case, every contact. But the key thing you're looking for is every chain of transmission. And the chains of transmission, they make themselves known very quickly because they explode with this disease. And the evidence from China suggests that you're finding the vast majority of chains of transmission and you're finding them fast. There's a number of indicators that support that. So those are the two key things. What's happening with respect to the trend, and then what's happening in terms of the chains of transmission.
Absolutely. Dr. Aylward, I understand that you were in Wuhan. So what was it like for you and your team to be there? Who have you talked to?
It was at one level heartbreaking to understand the loss of life, the devastation, the impact so much, beyond the disease itself, and how deeply scarred the population would be. But much bigger feeling that I left with was how inspired I was. No matter who I spoke to, whether it was a translator, whether it was someone in a train station, when we pulled in, it was always the same message. This is our duty. This is what we need to do. And that's a very hard thing to do a month into this. We tried to see every aspect of the response. We talked to the political leadership. We spoke to people who were in the trenches doing the contact tracing, trying to help find the contacts. We talked to people in the stadiums who were taking care of the mild cases. We talked to doctors who were taking care of the severe cases. We talked to nurses running the fever clinics. We talked to so many different folks to try and get a feel for what was happening there. I was sleeping 2 hours, 3 hours a night for a couple of weeks. But the Chinese colleagues were working so much harder. And one of the things that I keep telling my colleagues here is every time we got on a plane or on a train or on a little bus or a van, when I would turn around to ask one of my Chinese colleagues something, they were fast asleep because they're exhausted. They're working such hard, long hours. They would grab a wink of sleep wherever they could. Because what I saw was a tremendous sense of responsibility and of duty to protect their families, their communities, and even the world from this disease. It was truly inspiring. I left with such a deep admiration for the people of Wuhan and for Chinese society in general. The real heroes of this response are those people, sitting home in skyscrapers and apartment buildings for weeks on end. And, the few that I did meet, they said, we're playing our role, we're doing our part. And that is so powerful. And the world just owes such a huge debt to the people of Wuhan. And I just wanted the people of Wuhan to know that the world knows that, and we're sharing that story. What you're doing is so important. No, you leave a little bit of your heart in China, and especially in a place like Wuhan at a time like this.
So, Peter, is it a spillover from a lab?
The evidence says extremely unlikely. So, and that was a unanimous opinion on both the China and the WHO side. So I think that pretty much tells us it's not worth continuing that pathway of thought.
Now, Peter, one of your friends is Shi Zhengli. Madam Shi is the head of the Wuhan Institute for Virology. There were a lot of rumors about her, a lot of rumors about her institute, and you were speaking out, in fact, about what you have noticed and what's your analysis. Tell me more about that.
And I want to say they're more than rumors. They're some very nasty activity. I heard about this very early on in the outbreak, that our colleagues in China were being attacked. They were being accused of designing a virus and spreading it. And were getting death threats. And we wrote a letter to the Lancet, and a group of very important scientists that I know and that I talked to supported scientists in China who were fighting the outbreak. I mean, how outrageous that they're fighting an outbreak. They're being accused of causing an outbreak. Yeah. So for my mind, it's obvious to me that the work that Xu Zhongli has done for all of her career is both excellent science and for the public good, to help people to try and predict and prevent pandemics. And I work with her on exactly that, and I still do. We've both through tough times. I've had my own conspiracy attacks in the US that are still going on today, every day. But we stick to our mission and our goals to find the source of these pandemics and try and stop them. And Madam Xu is a powerful and strong person, as well as a great scientist and a good friend. So it was a very important moment to see her again in person, to sit down with her, with the head of the laboratory and the head of the Institute of Virology and the other people around, with the colleagues from WHO. And I think really importantly, the world needs to know, scientists who I don't know on the WHO team ask their own questions directly to the people at WIV about some of these very tough issues, these very sensitive issues. And that will be reported in the report. There will be a transcript. And they voted. They had an opinion on whether it was a likely scenario after they looked at all those data. Mm-hmm. I didn't speak until they'd made their opinion known, and the whole room discussed it. The whole room made their opinion known. Then I spoke, and it was a unanimous decision that this is an extremely unlikely event. So I do think that's a very significant finding. Some people will never support that, and they'll continue to promote these rumors and conspiracies. But these are scientists who know what they're doing, who've looked at a lab, who understand what goes on. And what we saw was a state-of-the-art facility doing good work.
When you say it was a unanimous vote, how did you guys vote? I want to know the situation then.
So we've been meeting in rooms here, conference rooms in this hotel, 3 rows back, a lot of people in a room. And we've been talking about every possible pathway this virus could have taken, from a bat to a human, whether through an intermediate host, whether through a cold chain, whether through a lab. And we got into, in those discussions, all the details and sort of debated what is the evidence for and what is the evidence against. There is evidence against. There's no data that show that SARS-CoV-2 was in any lab in the world prior to the outbreak. The closest relative is not the same virus. There's no evidence of unusual clusters of disease around the Wuhan lab or in the staff of the Wuhan lab. So we went through a whole series of bits of information like that. And eventually people then said, well, in my opinion, it is not highly likely, possible, or even unlikely. It's extremely unlikely. And other people around the room gave their opinion too. Every single person said extremely unlikely, including myself.
Dr. Gao, I'm sure you are very much aware of this politicizing the issue of the so-called virus origin. Now we also see the United States Biden administration trying to start 3-month investigation, quote unquote, about whether the origin of the virus coming from China. Now, China, of course, protested against it, suggesting that the U.S. should do investigation of its own and the WHO should do also investigation of the United States. Dr. Gao, as a scientist, how do you see so-called investigations like these?
I think if you want to do the investigation, why we have so much discussion about the investigation of the origin? Because we want to prevent for the next potential coronavirus outbreak.
True.
So that's quite understandable. However, for the origin of the virus, it's a scientific question. We got to leave the science for some time to figure out where the virus really originates. So at the moment, there's no evidence where the virus comes from initially. So this is, I'm calling for everybody, calm down. Let's work together to figure out where the virus originates. And China, as a scientist for myself, I'm also eager to know where the virus from. So because this will help us for the future. However, because this is a scientific question, it might take some time. Let me give you a very good example. When you are talking about the flu, after 1918, by then, even the scientists or the whole human being, we don't know what is the flu virus. The flu virus was first isolated in 1930s, first from pigs, then from human. So it always takes time. So this time, we are eager to know it, but there's no evidence. You would say, okay, it's first from China or first from any other country. Leave it as a scientific question. Leave it for the scientists to work together, to sit down. They have a brainstorm. Let them have a brainstorm. They will discuss it together. They will find out, by some time when and where the virus come from. In terms of the flu, it takes about 60 to 70 years, and people figured out. The flu virus, actually, there's an ecological cycle, not just from human beings. It's from migratory birds, and to the ducks, and to the chickens, and then to the pigs or swine, and then come to human. And then they have this circle of circulation of the virus transmission. So let's leave it for science research.
Dr. Gao, you and your colleagues at China CDC have been working through years with many of your international counterparts, including those that have been on the team for the joint research with China on the COVID-19 virus. What to you as scientists do you think are the most important things to bear in mind, given the very complex geopolitics and the political environment we're living in right now?
COVID-19 is something special. It's a pandemic. It's at the moment we have so much tension from all over the world. So everybody is worried. Everybody, because they stay at home. Some people might also already lost their job. I think that's for the public quite understandable. And then the politicians, they are trying to find something to blame something, and that's also quite understandable. This is what I'm calling. Let's calm down. To work together. And because for such a big issue like COVID-19, it's not only a scientific question. You can leave for the scientists, but also it's a question for the politics, for everything. Everybody has interest for that. Most of the scientists, we believe, we should work together for this science question. I think most of the politicians, they are very reasonable. Of course, from time to time, you can always have someone who are not really reasonable. That's also quite understandable. Let's really, work together. Let's call for this peaceful discussion.
That's all the time we have for today. If you'd like to see more, search World Insight or check out our YouTube channel. Follow us on Twitter and Facebook. I'm Tian Wei on behalf of the team. Thanks for watching.